Good morning, everybody. My name is Sabrina Adler, and I am a staff attorney at ChangeLab Solutions in Oakland. For those who aren't familiar, ChangeLab Solutions is a nonprofit organization that works with communities to provide solutions for America's most common and preventable diseases like cancer, heart disease, diabetes, obesity, and asthma. And our solutions promote the common good by making the healthier choices the easier choices for everybody. Today, I'm privileged to be joined on this webinar by Elise Hummel-Vitale of California Food Policy Advocates and Nancy Wyatt, a longtime family child care provider, both of whom you will hear from shortly. So I'd like to get started quickly. I want to say that while we are in part a legal organization, nothing in this webinar constitutes legal advice and does not create an attorney-client relationship. So before we dive into the content of the webinar, I have this warm-up slide here just to get everyone thinking about the topic of PSE in the childcare setting. So if you can take a minute to use your chat box to send in some of your observations about this photo from a nutrition and physical activity standpoint, and just to include the good and the bad. And what we will use the chat box for is to submit questions throughout the presentation that we will get to at the end. So if you can just take a couple seconds to put some observations in the chat box, and I can read some of them out. You won't be able to see them, but what do you see in this photo from a physical activity and nutrition standpoint that's both either good or bad? So you can type things in now. So some of the things in the photo here are that they're using sweets as a celebration, brownies. There are a lot of opportunities for physical activity in the background there. They are outside in a garden. There's a typical birthday party going on here. It looks like a relatively safe environment. So these are all great observations, and we'll get to a lot of these topics as we go through the agenda today. Thank you for submitting all your observations. So these are the things we're going to talk about today. As I said before, we're going to save questions until the end, but you're welcome to submit them at any time through the chat box, and we will flag them and get to as many as we can when we have time at the very end of the presentation. So the first thing I want to talk about is the regulation of childcare in California. And we're going to start that off with a brief poll. So the question I'm asking, and you can take your best guess, is how many kids ages 0 to 6 in California need childcare because their parents work? So here you'll see a poll page, and you can click one of those options and then press Submit, and your choices will be shown. I can read them out and tell you what the right answer is, but I'll give you a couple of seconds to submit your best response to this question. So the results are coming in. It looks like many of you have responded. It's about an equal split right now between the first, 1.7 million, and 1.2 million, which is the third answer. The correct answer is A, 1.723 million kids. So that's a lot of kids, and sets the context, hopefully, for why this is such an important topic. So in providing an overview of Childcare California, we're going to talk about these three things: what is childcare, what funding pays for childcare, and what authority governs childcare. I will start out by saying that this could be the topic of a webinar in and of itself. So I'm going to try and provide a general overview, but keeping in mind that some of these questions are actually pretty complicated, and you can feel free to ask questions if you want clarity on any of these specific issues. So to start with, when we're talking about childcare in this context, we're talking about something that is defined as non-medical care and supervision to children under 18 on a less than 24-hour basis. So this really encompasses all the types of care that you might think of. Sometimes it's called preschool, sometimes it's called daycare, sometimes it's called nursery school. But if there are licensed forms of childcare, they're all treated the same under the law, and some of them may be exempt from licensing, which we'll get to in a second. But you can also see that in California, it has the largest population of low-income children ages 0 to 5 in the country. There are 1.3 million kids. So this is another reason why the topic of childcare is such an important one in California. When we're talking about the categories of available childcare, there are really two main categories. One is licensed, and there are two main subcategories of licensed childcare. There are childcare centers and licensed family childcare homes. So the centers in 2012 in California, you can see there were 10,600 of them with 593,000 slots for kids. And there were 38,000 childcare homes with 370,000 slots. So just to give a little bit more information about what these are, family childcare homes are in the home of the provider. They're divided into small and large, small being up to 10 kids and large being up to 14. And the centers are generally not in the home of the provider. The maximum number of children allowed is set by the license for the specific facility, and there are a lot of licensing regulations that govern what can happen there. Then there is also license-exempt childcare, which does not need a license, but it must fall into one of several very specific categories that are license exempt. So for example, a provider who cares only for his or her relatives or only for the children of one other family other than the provider's own children. Some public recreation programs or before and after school programs or co-ops might also be license exempt. The next thing I'm going to go over is funding that pays for childcare. You can see there are three general categories. There's federal funding, there's state funding, and there is local funding. Under federal funding, you see TANF, which is temporary assistance to needy families, which is the federal program that provides funding for CalWORKs on the local level. Or on the state level, I should say. There are also social services block grants which provide funding for CalWORKs childcare. There are block grants from the federal government that provide money to the California Department of Education. There are Head Start programs. There is the Child and Adult Care Food Program, which I will talk about a little bit more briefly. There is also some state funding from the State General Fund and also from First Five, and some local funding. And just to provide a brief background on subsidy programs, which is a very complicated issue in and of itself, but there are generally two forms of subsidies, well, two main forms of state subsidies for childcare, the first being the CalWORKs program, which is divided into stages, and the second being the California Department of Education programs. But for the purposes of physical activity and nutrition, that distinction is not extremely important. So next we're going to talk about what authority governs childcare, and you can see this relatively complicated chart, which again could be the subject of a webinar in and of itself. And you see the State Department of Social Services and the California Department of Education as kind of the two main branches. The Department of Social Services runs the CalWORKs childcare programs, which you see on the left-hand side there. And they also have the Division of Community Care Licensing, which runs all the licensing for all childcare programs, whether they're funded by the Department of Education or otherwise. And under the Department of Education, you see Nutrition Services, which is the agency that administers CACFP, which again I'll talk about in a moment, and the Child Development Division, which administers the actual child care programs. And you see there on the right the R&Rs, which are the county resource and referral agencies. They're located in every county. And they serve a variety of functions, from helping parents to helping parents to find child care that meets their needs, and maintaining databases of providers, and working on quality of care. As far as the legal framework goes, again, this is a complicated area, but you'll see that there are many areas of law that touch on childcare. So the legislature will pass laws that go into the code, and the three areas of code, California code, that most affect childcare are the Health and Safety Code, which is where the licensing statutes are, the Education Code, which governs many child care programs, and the Welfare and Institutions Code, which is where the rules for CalWORKs are. And then the two agencies that we just mentioned, DSS and CDE, also issue their own regulations that govern child care. So when looking for what governs childcare in California, you could see anything that's on this bottom level, whether it's ACLs or ACIN or management bulletins, funding terms and conditions, and then on the left-hand side, all those statutes are all play a role in governing childcare in California. So a brief overview of the Child and Adult Care Food Program. As many of you probably know, it provides financial assistance to licensed child care providers for meals. This is a federal program regulated by the USDA, but it is administered on the state level by the California Department of Education, or CDE. And the funding is primarily from the federal government, but there is also some state funding for this. And what the program does is provide reimbursements for meals served. Any public or private nonprofit child care provider may participate, but eligibility is based on whether over 25% of the children in care are eligible for subsidized meals, and there's a formula for figuring that out. There are some record-keeping requirements, but there is definitely room for more participation in this program. As of 2011, there were about 6,000 child care providers in California who could have participated in this program but were not participating. Particularly of note in this context are that there will be new nutrition regulations released for CACFP later this year. They will be open for public comment, so that's something that you should be aware of. And you can see at the bottom that CACFP also has their own nutrition and wellness resources at that website. So now I'm going to move to what's the bulk of the subject of this webinar, which is talking about PSE in childcare. And to get that section started, I have another poll to talk about why we're really focusing on nutrition and physical activity in childcare. So the question we have here is, what percentage of California's low-income children ages 2 to 5 are overweight or obese? So here you can use this poll function to enter your response and click Submit. So the responses are flooding in, and it looks like the majority of people are responding with letter C, 33%, which is the correct answer. So you can see, once again, this is an important and prevalent issue. So I'm going to discuss PSE strategies, both nutrition strategies and physical activity strategies, and then I'm going to follow that up with some examples from the field, some case studies, nutrition and physical activity and combinations of the two. So first I'm going to discuss nutrition strategies, and I'm going to go through a list of strategies, and then we'll talk about how some of these have been implemented in specific settings in upcoming slides. So as far as nutrition strategies go, you can develop, implement, and evaluate food and beverage policies for childcare settings that meet USDA or CDC or Let's Move or American Academy of Pediatrics standards. Encouraging child care center and student participation in federal food and nutrition assistance programs like CACFP and SNAP. Supporting breastfeeding in child care. Improving the capacity of child care providers and food service staff in nutrition education and healthy meal planning and food preparation. Developing, implementing, and evaluating child care gardens. Starting and expanding farm-to-child care programs. Promoting access to drinking water. Supporting development of wellness councils. Establishing strong child care wellness and education programs and policies consistent. And providing parent education through the child care setting. And for physical activity strategies, we have developing, implementing, and evaluating physical activity policies and environments that meet USDA, CDC, Let's Move, or American Academy of Pediatrics standards. Limiting screen time. Developing, implementing, and evaluating active transportation programs, or transport, I should say. to and from childcare, establishing strong childcare wellness educational programs and policies consistent with Let's Move, improving capacity of childcare providers to provide children with opportunities for physical activity throughout the day, including outside play whenever possible, supporting development of childcare wellness councils, and providing parent education through the childcare setting. So next I'm going to talk about some case studies that will bring these strategies and interventions that we have just gone through a little bit more to life. The first case study that I want to talk about is increasing physical activity in childcare facilities in Butte County. And this was a California Obesity Prevention Program community grant, which provided funding to work directly on policy and environmental change to increase physical activity in childcare centers in Butte County. The project focused on state-funded childcare centers since they serve more low-income families. State-funded childcare providers were identified and partnerships were created to address the need. 4 of the 11 centers operated by the Butte County Office of Education were targeted, and there were 4 other locations as well. There were more than 350 preschools that were served by these 8 targeted childcare centers. There was a needs assessment that was performed at each center, and staff received training and in-class support. Each center also received a customized package of physical activity equipment that best met the needs of that particular facility. All 4 of the centers created and adopted physical activity policies that supported the recommended physical activity standards identified in preventing childhood obesity in early care and education programs, and addressed increased opportunities for active play, both through structured and unstructured play, enhancement of indoor and outdoor play environments, teacher training, teacher encouragement, and communication with parents. So you can see on the slide what the particular goals of this project were. One that I haven't mentioned yet, but that is very important, was the limiting of screen time in addition to the promoting and encouragement of physical activity. One example of the success of the project showed up in the pre and post surveys that were done with teachers. So prior to the training, fewer than 30% of teachers reported that children were engaging in at least 90 minutes of physical activity per day. And after these trainings and the passage of the policy, nearly 86% of teachers reported that amount of physical activity. In addition, while fewer than 10% of teachers reported more than 60 minutes of supervised or teacher-led physical activity per week in the pre-survey, nearly 86% reported that amount of supervised physical activity in the post-survey. So you can see there was a very large change pre and post with the development of this policy. Next, I want to talk about the Contra Costa Child Care Council's Choice Manual. This was developed by the network and Contra Costa County, and it was specifically tailored to take into account the reality of child care providers in California. It included a community and a parent focus in addition to a child care provider focus, and specifically took into account the needs of low-income families in child care. The purpose of this choice manual is to review existing practices, acknowledge work already being done, and also identify areas of change. It includes a toolkit which provides guides to self-assessment, including a self-assessment questionnaire, a best practices manual, information on policy developments, and writing and implementing a nutrition and physical activity policy, and additional resources. And you can see at the bottom of this page there's a link to that actual handbook, and everyone will be getting a copy of the PowerPoint presentation after this so that you can have access to these links and resources. The program was evaluated by UC Berkeley after the fact, and 50 child care providers completed a pre and post survey 6 months apart. And what they found was that the improvement in many areas. So in feeding practices, there was a 35% improvement in children's self-service of meals. There was a 34% improvement in providing parents with a written nutrition policy. There was a 29% improvement in posting menus for parents. There was a 22% improvement in providing guidance for parents on meals brought from home, and a 19% improvement in adults sitting with kids during mealtime. So that also shows you some of the things that were, some of the practices that were targeted in this project. There was also a decrease in the amount of whole milk served and an increase in the amount of 1% milk served, and there was a 41% improvement in parents receiving a written physical activity policy, 30% improvement in parents being informed about their kids' activity, 26 and 23% improvements respectively in parents getting information on physical activity and nutrition at home. Next, I'm going to talk about the Santa Clara County and Choices for Children project. Choices for Children is the APP in Santa Clara County, which means that it administers certain subsidy programs, but it also provides a variety of other child care services in the county. And they partnered with the county health department to change nutrition and physical activity behaviors with a focus on home child care settings participating in CACFP. So as in Contra Costa in Santa Clara County, the process included a self-assessment using the same tool that had been developed for Contra Costa, policy development, policy implementation through environmental change, which included monitoring and support, the provision of resources, technical assistance, and training for child care providers, and then a follow-up assessment. The focus was on 300 family child care homes that were participating in CACFP, which reached about 2,700 children. The nutrition education activities included reviewing policies that were already in place and in progress, identifying and delivering resources for new policy implementation, strategizing about solutions, arranging trainings for child care providers, and providing nutrition and physical activity education materials for providers to give to parents. The main areas that were identified in which improvement was needed were in serving family-style meals, restricting the use of playtime as a disciplinary tool, so in other words, not withholding playtime from kids as a punishment, and providing parents with written physical activity policies. There were various types of support offered to improve the feeding environment. So there were classes offered in 3 languages to parents and providers. They trained CACFP monitors to support best practices. Providers implemented CACFP best practice feeding environments, and providers were also taught to be role models for parents. So the outcomes you can see here on the slide, all the providers included in the program developed written policy statements, and those written physical activity policies were all implemented. Structured physical activity increased to 1 hour per day. And in addition to those things written on the slide, there was an increase in 1% milk consumption, more water was available, and structured physical activity, I said that one already, but structured physical activity increased to 1 hour per day. You can see here there's also a link to a Healthy Happy Eater class that was offered, and it's a training that's also available online that they developed. Next, I want to talk a little bit about Head Start. And before I talk about the I Am Learning program, I want to give a little more background about Head Start. Head Start, unlike most child care in California, is actually a federal program. It's federally funded, and it's for very low-income kids and their families. The primary target population for Head Start is kids 0 to 5 and pregnant women living under the federal poverty level. And it's funded by the Federal Department of Health and Human Services with grants provided directly to community agencies to administer the program. There were 112,000 kids in Head Start in California in 2011-2012, and of those kids, 18.6% were obese and 15.2% were overweight. The I Am Learning program was designed to increase daily moderate to vigorous physical activity and improve the quality of movement activities, and also promote healthy food choices among participants. It was first launched as a pilot program, I think in 2006, in 17 Head Start programs in West Virginia, where childhood obesity rates are nearly double the national average. The program aimed to increase children's moderate to vigorous physical activity, include their movement, and improve healthy nutrition choices. This approach was designed to reinforce the importance of the mind-body connection and the relationship between physical fitness and early learning. The program also provides strategies and resources for infusing quality physical movement and healthy nutrition choices with the familiar curriculum and into daily classroom routines. A key feature is that it provides implementation flexibility and allows programs to tailor and individualize strategies and activities to meet local program needs. The program required Head Start teachers to attend a 2.5-day training where they would participate in interactive workshops and develop strategies for program implementation. The training gave staff state-of-the-art resources and best practices for addressing childhood obesity in an intentional and purposeful manner. The results of this initial program, it was designed as a research to practice initiative to incorporate these best practice guidelines and policies. There was an extensive implementation evaluation of the pilot sites in West Virginia. They reported back a variety of positive outcomes for children, staff, families, and whole communities during the 2.5-year implementation period. Outcomes included a doubling of moderate to vigorous physical activity in participating classrooms. Children who were previously sedentary became active. Children experienced improvements on the BMI for age and gender growth curves. Motor centers were established in classrooms. There were great increases in parent participation as well, and parents were very receptive of the physical fitness and nutrition topics at parent meetings. Also, parents began substituting healthy treats in their children's lunches instead of candy and sweets. Picking up on that last point about parents' involvement, I want to also talk about the San Bernardino State Preschool Healthy Food Policy. This was a little bit of a different focus, and what this healthy food policy does is to require appropriate food at parent functions. So this was a policy that was implemented in June of 2012, about a year ago, and it requires that nutritious snacks be served in parent meetings. No high sugar products are permitted, that the food served in parent meetings should be low fat and high fiber, including whole grains, fresh fruits and vegetables, and low fat dairy. The policy itself includes a list of healthy snack ideas, such as a vegetable tray with hummus and some other things, so it provides some very specific guidance on what would be permissible. There are other components of this policy as well that address food safety, such as hand washing, and also safety hazards, such as choking hazards. So with that, I want to turn it over to Elise to talk about California's healthy beverages and child care law.
Thank you, Sabrina. Good morning, everyone, or at least all of us on the West Coast. As Sabrina said, my name is Elise, and I'm with California Food Policy Advocate. So for those of you who are not familiar with us, CFPA is a statewide policy and advocacy organization dedicated to improving the health and well-being of low-income Californians by increasing their access to nutritious and affordable food. Let's see if I can make the slides move. There we go. Before I dive into today's presentation, as a bit of disclosure, I wanted to explain that although CFPA is a policy advocacy organization, this presentation is meant purely for educational purposes. I know folks can get a little bit nervous sometimes about the word lobbying, but rest assured that's not what's happening today. Today I will be sharing about our experience with a passed piece of legislation, and the key word here is passed, P-A-S-T. It's not a proposed or pending piece of legislation. It is in fact law. Okay, so on to the good stuff, what we'll cover. Today I'm going to explore the ins and outs of AB 2084, also known as California's Healthy Beverages and Childcare Law. This will include the partnerships and the research that need to occur before the bill is successfully passed, and also the research we conducted to help illuminate barriers and facilitators to the implementation process, which I think will be of great interest to most of you. So to start, I thought I'd simply remind us all of the importance of early intervention. I'm sure I don't need to tell most of you, but the research is very compelling. Early intervention is key. And if we ignore the prime opportunity child care has to influence the health of our youngest residents, well, it would be short-sighted. Furthermore, it's worthy to point out that there's a clear structure, as Sabrina nicely described, in place to reach licensed child care providers. Through licensing in California, we have access to over 1 million children who attend over 45,000 licensed child care facilities. So in a few slides, I will get into the details of AB 2084, our Healthy Beverages and Child Care Law. But first I wanted to tell you a little bit about the work we, plus many others, did to prime the policy environment. This includes some research. In 2008, we conducted a pilot study in Los Angeles, which led to significantly larger studies statewide that assessed nutrition environments in licensed child care settings. The findings from both of these studies showed that there was great room for improvement in the foods and beverages being served in child care, and presented some clear policy solutions to encourage healthy eating, including the adoption of nutrition standards for licensed child care. At the same time as this research was happening with our partners, some complementary work was occurring, which was creating a buzz among important stakeholders. So for example, in 2007, the Strategic Assessment of the Child Care Nutrition Environment and Advisory Group, that's a mouthful, an interagency stakeholder group of early child education experts from state and local child care and development agencies and advocacy groups, conducted a strategic assessment of the factors associated with poor nutrition, inactivity, and overweight among young children. They produced a report, and in that report, among many other recommendations, it suggested the enactment, again, of nutrition standards for licensed child care. So we were seeing a growth of evidence and support in our field for nutrition standards in child care. And then last but not least, there was movement at the Capitol that inspired both legislators and the governor. In 2009, CFPA introduced AB 627, which we called Improving Nutrition in Child Care. AB 627 was vetoed, but it would have established some basic nutrition and activity standards as a condition of child care licensure, and it would have developed some pilots to evaluate promising strategies. So while AB 627 did not pass, it set the stage and served as an excellent education tool for our legislators. And then in 2010, the same year, we introduced AB 2084, which I promise I will get to in just a moment. The governor sponsored and signed SB 1413, a bill that requires all K-12 students to have access to free drinking water during mealtime. And this bill is relevant here because SB 1413 really primed the governor to feel connected and invested in healthy beverages for children. So why beverages? Well, as you can see on this slide, there is plenty of evidence to encourage policymakers to take a look at the beverages being served in child care. We know that sweetened beverages are a key dietary determinant of weight, and we know that 84% of preschool-age children drink sugary drinks. In fact, children and adolescents derive approximately 15% of their total daily caloric intake from sugary drinks. And we're still facing an obesity epidemic. Approximately 1 in 4 preschool-age children are overweight or obese. And lastly, there is evidence, particularly here in California, that shows there's room for improvement in the beverages that are being served in child care settings. So the grand reveal, AB 2084. Well, as I said, it's the Healthy Beverages and Child Care Law, and it was implemented in January 2012 here in California. The law requires that all licensed child care centers and family child care homes comply with these healthy beverage standards that you see on the screen. Water available to children at all times, including meals and snacks. Only 1% or non-fat, unflavored milk served to children ages 2 and older. No more than 1 serving of 100% juice each day, and no artificial or natural sweeteners. To our knowledge, this is the most comprehensive statewide child care beverage legislation in the country, and we are pretty proud of it. But just because we passed a law doesn't mean that it necessarily gets implemented. Laws where change can start, but the next step, the big step, implementation, is the real work. So to better understand how this law was being implemented, we partnered with UC Berkeley Center, Atkins Center for Weight and Health, and the Samuel Center. We were funded by Robert Wood Johnson Foundation, their Healthy Eating Research National Program, to assess the impact of the Healthy Beverages Law and the barriers and facilitators to implementing this law. Lucky for us, we had some statewide baseline data from that research we did back in 2008 that told us what beverages were being served back then. So about 6 months After 2084 was passed, we posed the following questions to child care providers in California. 1, are child care providers aware of the new law? 2, were there changes in the beverages being served? 3, was there variance in compliance? For example, were CACFP facilities more likely to comply with the law? And then lastly, what were the facilitators and barriers to implementing AB 2084? To answer these questions, we did the following. A survey was administered to a randomly selected sample of licensed child care providers to compare beverages served in 2008 before the law as compared to 2012 after the law's implementation. Then in-depth interviews with providers and licensing officials and observation at a few select child care sites were conducted to identify barriers and facilitators of compliance. And lastly, a one-day policy convening with local, state, and national child care stakeholders was held to identify research and local, state, and national policy implications. In both years, we started with a list of child care providers in California. From this list, we randomly selected a smaller group, and then the surveys were administered. In 2008, 429 sites were included in the analysis, 71% of which were enrolled in CACFP. In 2012, 435 sites were included in the analysis, 61% of which were enrolled in CACFP. And so next, in the upcoming slides are going to feature some key findings that I thought you all would find interesting. But this is not a comprehensive review of the study findings because, let's be honest, that would take all day. So let's start with awareness. Were respondents aware of the new law? We found that most, but not all, most of the participants knew about the Healthy Beverages Law. Nearly 60% of child care providers reported that they knew about the new beverage standards when the survey was conducted in the spring of 2012. And this is important to note because the spring of 2012 was before any official communication had come out from the state. So it's likely that awareness of the law has now increased. So not shown on this slide, but a few more details. There was a significantly higher percentage of CACFP sites that knew about the law, 67% versus non-CACFP sites, 42%. And an interesting twist, CACFP family child care homes were the most likely to report knowledge of the law, 81% of those providers, followed by Head Start at 69%, CACFP centers at 67%, and then state preschools at 52%. Behavior change. Survey respondents were given a list of beverages and asked to indicate which were provided to children the day prior to the survey. So I'll quickly highlight some significant behavior changes that were documented by this evaluation. Water access improved. Woohoo! As documented on the left side of this graph, significantly more sites made water available for children to self-serve both inside and outside in 2012. And on the right side of this graph, you will see that we also found a significant increase in the percentage of sites always serving water at meals and snacks. And this is all fantastic. Increases are great. But as a healthy beverage advocate, I would like to eventually see 100% of providers reporting that water was provided with meals and snacks. The gap in this graph shows that there's still some room for improvement, and you will see this opportunity on some other slides. So next, the type of milk being served also improved. In 2012, significantly fewer sites usually served whole milk to children ages 2 and older. You can see this on the left side of the graph. It dropped down about 9%. The practice of serving non-fat milk significantly increased from 2 to 7%. And there was a non-significant change you can see on the right side in the percentage of sites that usually served flavored or sweetened milk. It's a small decrease from 2008 to 2012, but it was low at both time points. Again, there are some opportunities for improvement here, particularly with the children ages 2 and older being served whole milk. And then lastly, there were improvements in other types of beverages being served to children. In 2012, the proportion of sites serving 100% fruit or vegetable juice more than once per day decreased significantly by 7%. Other changes were not statistically significant, but we did see a decrease in the serving of any sugar-sweetened beverage. Again, we'd like to see, and in accordance with the law, these numbers at 0. So I just told you about the significant improvements in some of the beverages being served in childcare in California, but we were also interested in full compliance with the new law as determined by the 4 provisions of the law that I mentioned earlier. On average, 38% of the facilities were fully compliant, but this varied greatly by the type of childcare, ranging from a low of 15% and a high of 53%. I think the most interesting and promising piece of this graph is that slightly more sites on CACFP were fully compliant as compared to those not on CACFP. So barriers and facilitators. To better understand implementation, we asked respondents what makes it difficult and what makes it easy to serve the various healthy beverages. I only have time to cover the barriers for one type of beverage today, unfortunately, water. Unfortunately, it will be water. But for more details, I will be providing you with a link to our policy brief at the end of this presentation. So on to water. Most sites, 77%, reported that they experienced no barriers to serving more water with children, or to children, which is great. But there were a few barriers reported. Most commonly, we heard that there was a misguided belief that there was a CACFP government rule that prohibited water with meals and snacks. This is not true, but it does have some implications about the consistency of communications child care providers are receiving. Some other barriers, that water was not available outside, that bottled water was not reimbursed by CACFP, or just in general the cost of bottled water. And this brings up the larger discussion about water safety and bottled water. While, of course, unfiltered tap water should not be used in communities where it's deemed unsafe, this is not the norm. In fact, none of the respondents reported that their tap water was unsafe to drink. If you have concerns about the safety of your tap water, you should contact your local water utility department. But pending safety, as healthy beverage advocates say, that tap water should be the default thirst quencher because it's healthy and it's essentially free. So then what makes it easier to serve healthy beverages in the child care setting? Here are some facilitators that we heard most frequently, and they're pretty straightforward. Having a healthy beverage policy in place, providing information to families, or serving only healthy beverages promoted the consumption of healthy beverages among young children. I'm going to quickly share a few self-reported best practices that encourage the consumption of healthy beverages. Here you have, you can see there's serving water at the table in age-appropriate containers. You know, even as adults, we don't always remember to consume water, even though it's healthy for us. The same goes for children. It's nice to have the water available to them so that they can see it and they're reminded that if they are thirsty, they can drink it. And then another biggie in this photo is adults leading by example. They themselves drinking the water and encouraging the water drinking. Here we have self-serve, family style. It promotes autonomy and desirability of the beverages being served. And then lastly, making water easily accessible throughout the day, both inside and out. Here you'll see, in the photo, you'll see the water containers lined up at child height indoors. And then here's an example, outdoor option, a water jug and cups made easily available, again, at the height where the child can see it. So I just quickly covered a bit of research, but I'd also like to point out the policy implications we identified. From this study and through our stakeholder interviews, our observations, and the policy convening, we developed the following policy recommendations, which could be implemented at the community level or the county level, the state, or even the federal government level. So starting at the top of the circle, our first recommendation is to make tap water easily available and accessible to children in child care throughout the day, including on the table, at meals and snacks. I said it earlier, pending safety, tap water should be the default thirst quencher. Number two, we're suggesting that healthy beverage recommendations be included in all child care nutrition guidance and resources, whether those be issued by USDA, state licensing and monitoring authorities, particularly by child care partner organizations and child care facilities. And it's important to make these available to the providers, the parents, and the children. Number 3, require nutrition training, including a unit on healthy beverages and the benefits of tap water, as a condition of licensure and as a criterion in the quality rating systems for our child care facilities. But of course, it's important to ensure opportunities for child care providers to take these trainings at no or minimal cost, so that cost isn't a barrier for provider participation. Number 4, include healthy beverage standards in staff and parent handbooks, and require that all beverages brought from home, whether they be for meals, snack times, or even celebrations, adhere to these healthy standards. And then a true best practice, I said a little earlier, is staff should also adhere to the same healthy beverage standards as the children while on duty. And then finally, use these research findings to inform federal guidance on the upcoming CACFP meal pattern changes, which we really have not discussed at all today and is quite honestly a whole other presentation, so I'll leave that face value. But additionally, I encourage you to use these findings to help shape other state and local efforts to adopt healthy beverage standards. A few takeaway considerations from AB 2084's journey and our research. Just because there's a law in place does not mean that we will have full compliance. If you remember from my previous slide, only 38% of respondents at the time of the survey were fully compliant with the new beverage standard, even though 60% knew about the law. And a little more food for thought. Compliance with the law does not guarantee best practices. Those best practices are needed to help implement the true intent of the law. So while AB 2084, the most comprehensive beverage standard in the nation, is now in place, we would argue that more training, monitoring, promotion, and research is needed to implement the full intent of the law. So a few next steps for you to consider. How can we realistically monitor and enforce these new standards? And how do we effectively get the word out about this new law? If you have thoughts on this, I would love to hear them. And then I mentioned training in the last slide, but I'm putting a call out to all of you to consider developing, piloting, and evaluating innovative methods to educate both providers and parents on the importance of healthy beverages. And then finally, here's a resource for you. I think we saw this in one of Sabrina's slides. Healthy Beverages in childcare.org, one long word. This is a fantastic website for parents, child care providers, advocates, professionals, policymakers. It has a lot of research, resources, and best practices. And if you click on the What's New in the upper right-hand corner of this website, you'll find the most recent research and resources, including our policy brief discussing the research I covered today. So thank you so much for your attention. I will hand it back over to Sabrina now.
Thanks, Elise. Now I'd like to turn to child care provider Nancy Wyatt. And Nancy, if you could start off by just giving everybody a brief overview of your background in child care, and then we can launch into some questions about your experiences with nutrition and physical activity in child care.
Okay. Hi, everyone, and I want to thank you for this opportunity to share my experiences. I've been a licensed family child care provider in California for almost 30 years. And over the years, I've served on many organization boards, and I've been a public policy chair very often. I'm an advocate, and I comment, testify, write, and call. And sometimes I write and publish training material, or I'm a consultant or a trainer. I'd say I'm an information addict. And I'm very interested in laws, regulations, and policies that support quality family child care. Currently, and for quite a number of years, I've been moderating a statewide e-group for California family child care providers called CalKids.
Great. Thank you, Nancy. So can you start off by telling us about some of your successes that you've had working in this area of physical activity and nutrition in the child care setting?
Great. Okay. I get a real kick out of growing vegetables and fruit with the kids, and I've had a lot of success from that children have become a great deal more interested in eating the vegetables and fruit. A cute little story, and I'll skip some of the other ones for time, is that sometimes I can't pick and wash the broccoli fast enough. The kids gather around the broccoli plants to eat them on the spot. I'm telling you, they ask for more broccoli as if it was candy. They can't wait for their turn. It's really amazing. And I've had an opportunity, success with training and rating providers for a local First Five funded project. And for about 8 years, I saw providers make great changes in their meal servings after receiving training. So many providers are dedicated and just terrific.
Can you tell us a little bit more about what that training involves and how it came about?
We were using the Family Child Care Environmental Rating Scale, and we wanted the providers to improve the quality of their program by meeting the standards. And one time I did a workshop that I recommend. I made lots of different colors of Play-Doh, and I had the providers practice serving. I said, okay, right now you're going to be serving an infant, age 12 months, who's got teeth, and okay, show me how you're going to pretend that this green Play-Doh is this and that, and show me how you're going to cut the food and put the servings on their plate. So we had a chance to really visually learn, what size the pieces should be and how much of each kind of food group should be on the plate as a minimum. That was kind of fun.
That's great. Are there any other opportunities that you'd like to share that you see for nutrition and physical activity in the child care setting as a provider yourself?
Well, let's see. I talked about the opportunities that I had already had. Opportunities for more training. I want to get the word out that we need to be careful about, our enthusiasm to try to make sure that we're educating and preparing children for school. Be careful that our circle times aren't too long for the young children, that we're not giving them too many activities where they need to sit at the table. We want those kids to get exercise and practice their gross motor skills. So that's something that I think we need to spread the word about, that parents might be overly impressed with school sitting types of activities for young children, and I'm hoping that as I go visit the providers' homes and the projects where I'm doing ratings, that they're going to be getting the message and that they'll be giving the message to parents that we got to let these kids move around.
And so can you also tell us about some of the challenges that you face as a child care provider in nutrition and physical activity areas?
For physical activity, for my equipment, it's really hard for me to have the room I need for climbers and slides, for all the fall zone equipment, and that stuff is expensive. And when I've got children of different ages here, my really young babies need to sleep often, so I have to really be watching for the opportunity to get ourselves out in the yard. The young kids sometimes need 2 naps, and then I have a lot of parents that have a lot of thoughts and feelings about milk. For example, maybe their child has a cold. They walk in the morning and they say, "Don't give my kid milk. I don't want it to have a lot of mucus." And then I have kids that are picky eaters sometimes, and it's not always easy to change those habits. I have had some success, but it's tough. And limiting screen time, I'm telling you, the school-age kids now that are coming here, they don't like that I'm not going to let them play the computer all day. And they'd rather be at home, or they'd rather be somewhere else where they can do that. And so maybe my holding out on this is going to cost me some money, but I'm going to do the right thing.
So dealing with the reality of kids' preferences is a challenge, as well as parents' preferences when they may not be in accord with your philosophy and thoughts on how to advance physical activity and nutrition in the child care setting.
Exactly.
Well, we're reaching the end of our hour, so I want to thank you, Nancy, for sharing your experiences, and also thank Elise for contributing so much important information to this webinar. And I want to move on to a slide that includes a list of resources, and several people have asked about whether they'll get a copy of this webinar, and yes, everybody will be getting a PDF copy of the webinar. Unfortunately, it will not include notes, but I encourage you to follow up with specific questions if you have them. And the links to all these resources, which which are much of what we've been talking about, will be there for you as well. So here is a list of some of many resources, and there have been some scattered throughout the presentation as well, so you can go back to look at those as well. And then I want to take the last 5 minutes to answer some of your questions. So you can submit any question you'd like via chat, and I apologize in advance if I can't get to everything, but I will start going through some of these and send them along to Elise or anyone else if they are not for me. Somebody asked earlier if there were already a lot of regulations about nutrition, water availability, and physical activity for CACFP participating centers. There are already CACFP regulations. The new regulations that I alluded to that are coming out later this year are new and updated nutrition regulations. To my knowledge, there is not a current physical activity component to the CACFP regulations. There are meal patterns which prescribe kind of the amounts and certain types of foods that need to be served as part of CACFP, but they are updating those similar to how they updated the school lunch and breakfast nutrition requirements recently, and that is what's coming towards a little bit later this year from the USDA. Someone is asking whether Nancy would be willing to share her contact information. Nancy, I will field that question to you, or if there is a way that people can maybe filter questions if they have follow-up questions for you, Nancy.
I'm glad to give out my my email address. It's Nancy Wyatt, W-Y-A-T-T, @sbcglobal.net. I love to help.
Great. Thank you, Nancy. Somebody mentioned, which I will share with everyone, that Contra Costa First 5 has launched a healthy beverage campaign that has been getting rave reviews nationally. It's noted that this is not the same as the First 5 Commission campaign. It's the Contra Costa specific First 5.
Right, and Sabrina, I'll add, it's called Sugar Bites. There's lots of great resources online if you Google it.
Great. Thank you, Elise. Somebody is asking about available funding to help in developing these policies. That's a great question, which I actually don't know the answer to off the top of my head. But Elise, are you aware of specific resources for funding for these sorts of initiatives or efforts?
I'm not sure I could identify specific resources. I think those of us who work in nonprofits recognize that finding funding is always is often a challenge. So I don't have any specific recommendations. But there are foundations that are invested in improving or recognize the importance of early intervention and are increasingly interested in investing in child care and age 0 to 5. So I encourage you all to do some research. And then maybe if you're interested, you're more than welcome to email me and we can have a conversation. My email address is Elise, my first name, E-L-Y-S-E, @CFPA, as in California Foods Policy Advocates.net.
Yeah, likewise, you see the contact information for Lisa and Betty at CDPH here. I'm sure they would be happy to field your questions as well, or you can contact me if you would like. My email address is sadler, S-A-D-L-E-R, @changelabsolutions, all one word, .org. Someone else shares here that an easy access to the CHOICE resource and to stay on top of CACFP is a website that is www.ccfproundtable, so ccfproundtable.org as a website. So we have about 1 minute left if anyone has any last-minute questions. Otherwise, we will sign off, and we will be providing this this PowerPoint, as I've said, as a PDF, as well as links to the other resources available in an email that everyone will be getting. And thank you again for your participation this morning, and please follow up if you have additional questions. Thanks, everybody.